Hey guys, it's Anthony. This is training day 5, recovering from heart surgery and Lyme disease. I'm feeling better today, so we're going to progress a little more. The isometrics, the strength training, we're going to do the same exercises, hopefully for a little bit longer. And then we're going to do the cardio again on the bike, and this time we're going to do cardio output training. So we'll show you how to do that when we get to that portion. But again, we're going to start with the towel, just like last time. We're going to stimulate the sensory component of the motor nerve that controls the abdominal musculature. So we're just going to be moving it around here, along the ribs, down the obliques, down to the pelvis there. We're just going to be stimulating that skin. Make sure you go up on the other side as well. And you should feel that core muscle, the core musculature facilitating and contracting some, really firing those muscles up. So you can do it for a little while. Again, you might need to do it longer, but there we go. So we got the core muscle that's starting to engage, and we're going to engage it even more, just like last time with the vestibulocholic reflex. So I'm going to put my hand on my head, because I asked to do it with head position. We're going to keep it nice and straight, pushing forward. There you go. We're going for about 10 seconds this time. It's feeling good today. We'll try it again. There you go, and make sure you're using your head to push into your hand. That's what's going to facilitate that core muscles. Here we go. We're continuing with our core facilitation. We're going to do some fascial line stimulation. You can go down like this. You want to try to maintain this position where you're flexed a little bit here and the pelvis is tipped backwards, not forward where it's tipping forward like that, but tipped backwards. Think of your pelvis like a bowl, and you want to tip that bowl backwards. Okay, you're gonna hold that position. The fascial line is where the obliques come in, and the rectus abdominis, that six-pack abs, where those meet. That's what you want to stimulate. So hold it there. Really dig in. And then come out of it. Try not to like lean back, but lean forward out of it so you maintain that good core position. So rest a little bit, then go right back into it. From the ribs all the way down to the pelvis. This is a good way to help facilitate that core. And then back up. Try to maintain that core position. Feeling good today, not so lightheaded as I've been. Right, back into it. Next one, we're going to do a tuck hold exercise. So again, keeping the ribs down, pelvis tip backwards, going down like this, and instead of the feet being on the floor, the feet are going to come up. You'll lift your bottom off the floor at the same time as doing a crunch. Hands can be down or up. Don't be cranking the neck forward. Try to keep it in a continuation of the spine position. So here we go. Then come out of it without relaxing back, because we want to continue to practice that position with good core position, ribs down, pelvis to back. we go again. And out. Again, maintaining that good core position. And one more time. Doing the hold again right here. We want to lift up right here as high as we can while maintaining the knees in front of you. I want to keep a nice and stable position. Same core position, ribs down, pelvis tucked. So here we go. Okay, there's one. Now there's not a lot of room in here, but just like this, doesn't matter. You don't need a lot of room. Just a couple chairs, little space. We can still get a good workout in. Building back up. So here we go. Round 2. Feel a little lightheaded, a little winded, but we're getting better. Getting better every day. So make sure you're pushing up, lifting up as high as you can, and you can do your exercises again anywhere, even in a small space. Okay, last one. Keeping it nice and stable. Now we're getting into the cardio portion. We're going to do the cardiac output training technique. So this one, especially with sitting down on the bike, we're going to be working at the 120 to 140 range. So we'll bring it up to about 140, lock it in at that beat, and try to maintain that for a minute or two, or just a few minutes, and then we're going to bring it down to 120 and try to lock that in for a few minutes as well. This will build your control of your energy output and is very beneficial for overall health and fitness. So let's get started. We're starting with a few minute warm up, and then we'll get into the cardiac output training. Again, we're gonna get the heart rate, drive it up to 140, maintain it there for a couple minutes, and then bring it back down to 120. So we want to stay in those ranges, a very controlled heart rate. We want to bring it up nice and controlled, maintain it, and then bring it down. At first it will be difficult if you're not used to this kind of training, but especially after heart surgery, we'll see how it goes. And then we're going to do a few rounds of that, and then we're going to do a cool down. So right now we're just doing a few minute warm up. We're going to keep working on this and see how it goes. You got to listen to your body, what you can do each day. There are testing measures that we can use to see if the nervous system is ready for it and prepared, but we can get into that in a later video. But for now, we're going to work on the cardiac output. All right, and a couple more minutes and then we'll get started. We're a few minutes in now, getting warmed up. We're going to get started, work through this cardiac output, see how I do, and we're going to go for a total length of time for this cardio session is we're going to try to do 15 minutes, including the warm-up and cool down. I'm at the end of the 3 rounds. Went pretty well. Got more and more difficult to control my heart rate each round. Even at the start, the getting it down to 120 was difficult. But doing better. I'm happy that I was able to do that today. We're going to keep working on this. Breathing is an excellent way to slow your heart rate down when you focus on long exhales. Inhales increase your heart rate. and exhales decrease your heart rate, so they slow your heart rate down. So when you're working on recovery, it's very important to work on improving your speed of recovery. How quickly you can recover, bring your heart rate down from exercise, go from that sympathetic fight or flight nervous system activation to parasympathetic, which is rest and digest, calming your system down so it can recover from the activity. We have a limited amount of energy for each day, so make sure you're using that wisely, and it's very important to learn to control it. Once you can control it, then you can allocate that energy where you see fit, when you need it the most, and you'll just have much more energy throughout your day because you're using it when you need it versus inefficiently, just whenever you get stressed. Throughout the day, we can talk more about that later in another video, but another good training day so far. Another step forward in my recovery from heart surgery and Lyme disease.